Hi, this is Kirk, the bariatric carnivore. Abraham Maslow said it really well many years ago. Said, look, if your only tool is a hammer, then you have a tendency to look at all your problems as nails. And that's a great observation, and I think it holds true to your doctor, because he thinks that his only tool that he has in his tool chest is his prescription pad. And it's part of the psychopathic medical system that is just absolutely destroying American health. And the Accord study, I think, kind of proves that. So let me go into a little bit more detail. And when I say, the medical system is psychopathic, I'm not saying your doctor's a psychopath, but he's part of a psychopathic medical system that works with a complete callous disregard for your health. And it's almost something that you can see every time you go to the doctor, because a doctor doesn't tell you, oh, great, you're healthy, let's take you off your medication. No, they keep adding on to them every single time, and you're not getting healthier, you're just getting more prescriptions. How many times have you gone to a doctor and been de-prescribed stuff? That's the frustration of the whole system we've got. This is what got me up to the point where I was on 10 medications every single day when I was 50 years old. It is much better right now where I'm on 0. But let's go back to the Accord study. The Accord study was done back in 2008, and it was a fascinating one. What they were trying to do was to save people's lives, because the number one killer in the country are heart attacks. And the number one reason people have heart attacks, if you look at all the causes that can cause a heart attack, poor metabolic health, particularly type 2 diabetes, is the number one marker. So if you want to have a heart attack and you want to guarantee it and you want to put yourself at high risk for one, become a type 2 diabetic. And frankly, that's where most people are. How bad is type 2 diabetes? Well, UCLA did a study recently where they looked at the population of California, which is generally one of the healthier populations in the country. Colorado and California are usually right up there as far as having the most non-obese people of any states in the country. And they found that over 60% of the state was either a type 2 diabetic or pre-diabetic. So they're a huge marker. 60% of the state is at risk of having an early heart attack. So that should be a wake-up call to you to realize that, look, you may think you're yourself as healthy, but you're probably a type 2 diabetic. And one of the best markers of type 2 diabetes is an A1C level. Now, for those of you who are not familiar with A1Cs, what that is it's a blood test. And what this genius doctor, what he did was he looked at red blood cells and realized that blood sugar, glucose, has a tendency to glom on or glycate to red blood cells. And because a red blood cell lives for about 3 months, you can figure out somebody's average daily blood sugar by looking at the A1C level. I mean, there's ways of checking your blood sugar. You can use a glucose monitor, where you prick your finger and you mark that, or you can use a continuous glucose monitor. And those are great tools. But if you really want to see how you're doing over the course of 3 months, A1C is really a great marker, and it's a fairly inexpensive blood test to get done. Highly recommend you do it. So, the goal of the Accord study was to take all these people who had an average blood sugar, average A1C over 8, and get it down close to 6. And the way they were going to do it was by throwing the kitchen sink of medications at them, increase their insulin, and by the way, the trial participants, they recruited 10,000 people to be part of this thing, and all of them were in bad shape. I mean, there were type 2 diabetics with waists over 42 inches, most of them, obese, and just basically heart attacks waiting to happen. And they pharmacologically tried like crazy to lower the A1Cs down to 6, which I think is still too high. Frankly, I think you want an A1C somewhere between 5.1 and 5.6, somewhere in that range. And that will keep you out of the range of being pre-diabetic. But they were trying to just get it down to a modest goal of 6. but they had to cancel the study midway because it turns out that when you threw all those extra pharmacological agents at the problem, people died. And when you dig into the details of the study a little bit more, you realize why. Because people were gaining, when they were giving them the extra insulin, they were gaining on average 20 pounds. And frankly, that to me makes total sense. Because what does insulin do? Well, insulin does a lot of different things in the body. It's an important hormone. But one of the things it does really well is it gets extra glucose out of the bloodstream and stores it in the fat cells. And that's why, when you throw in extra, how many people do you know that are type 2 diabetic and take insulin, but they keep gaining weight all the time? They just never can lose the weight. Well, part of the reason why is they're throwing in extra insulin, which is a fat storage hormone. And that's what they're doing. Makes total sense when you think about it. But again, what's the only tool that the doctors have? It's a prescription pad. And Big Pharma says, hey, you got to lower the blood sugar levels. And the way you do that is by throwing more insulin at it. But is there another alternative? And yeah, there is. There's a big one. See, what the Accord study to me shows is you can't solve a lifestyle issue with pharmacological agents. And frankly, if you want to solve type 2 diabetes, then the only way to do it is through lifestyle, lowering the amount of carbs. So why don't they do that? Well, I think, frankly, there's two reasons. Number one is a lot of doctors think that patients aren't going to be compliant, and therefore they don't bother teaching them. Really, the job of a doctor should be that of not only your healing, not only should they be healers, but they also should be teachers. And they should be telling you, like, look, you got to reduce the amount of carbohydrate. You've got to reduce the amount of processed food in your diet. But because they think most people won't do it, they don't teach it. All they know is they've got our big, powerful tool, which is more insulin, more prescriptions. And that's why I think we've got this psychopathic system. There's no doubt in anybody's mind, because there's a company by the name of Virta Health that has done lifestyle. The whole goal of Virta Health is to help people reduce the amount of carbs. And they've shown conclusively in over 3 years of research that when you reduce the amount of carbs, you reverse type 2 diabetes. So it's out there, the information's out there. The number one killer in this country is heart disease. The number one cause of extra heart disease is type 2 diabetes. They're curing it, and everybody is ignoring it. Why? Well, frankly, it's because science advances one funeral at a time. And every one of your doctors has been drummed into their head since the moment they went to medical school that the most dangerous thing out there is high cholesterol, even though there's no evidence to support it. It was a hypothesis created by Ansel Keys. It's been around. It's been part of medical religious dogma for years. But the evidence keeps coming in that shows that, look, the people with the highest cholesterol levels live the longest. Yet we keep thinking that cholesterol is the problem. We've got drugs, $1 trillion drug called statins that will solve cholesterol. But it hasn't reduced the amount of heart attacks. Look, you'd think that when back in the 1960s, half the adult population smoked regularly. It's now down to 10%. There should be a marked drop in the number of heart attacks in this country, yet there isn't. Why? Because our cholesterol, the amount of carbohydrates and processed food that we've eaten increased dramatically too, because everybody was terrified of cholesterol. So you had a reduction in smoking, but a fear of cholesterol, and these two things canceled each other out, basically. And we've had an increased rate of heart attacks. And it's frustrating beyond belief that the system just will not open up its mind to the fact that the science is out there. It's pretty darn clear. Cholesterol ain't the problem, it's the blood sugar. And the way you get rid of the blood sugar is not by throwing more insulin at the problem, but by reducing the amount of carbs. And when you do that, you get metabolically healthy. That's why I think the keto low carb movement is such a powerful grassroots movement that more and more people are getting the message that reducing the amount of carbs improves their metabolic health, which makes them healthier. And it starts changing people's lives. Time and time again, people report this idea that, oh my gosh, the brain fog has gone away. Well, what do they mean by brain fog? Well, when you look at the studies, you realize that neuroconnections within the brain get damaged by high levels of glucose, basically too much carbohydrate in the system. And when you get rid of the carbohydrates, you get unfoggy. Your brain starts to work better. Alzheimer's disease is often referred to as type 3 diabetes. I mean, if you want to have the ultimate form of brain dysfunction, continue to eat carbs and processed food. It's all but guaranteed. That's the way to get it. And if you don't, you won't have that problem. Frankly, I'm not saying that, keto, low carb will solve every problem that ails you, but it will make all of them significantly better. No doubt about it. This is the way to get yourself healthy. And it's frustrating that our doctors just completely continue to stick their heads in the sand because of medical dogma. It's almost a religion with them. And frankly, I think you can tell when a doctor is a religious cholesterol zealot pretty darn quickly. If they want to give you a statin no matter what, even though you can show them, hey, how come people live longer when they have higher cholesterol levels, and they throw you out of their office? Okay, the guy's a zealot, and you don't need to go to him anymore, as far as I'm concerned. There's part of a psychopathic system. This is Kirk, the Bariatric Carnivore. If you like this message, if you think more people need to hear messages like this, please hit the like and subscribe button. It's the only way we can get the message out to more people. And I try to put out a new message every single workday. I will talk to you soon.